Hi, good morning. My name's Gracie Nichols. I'm the nurse practitioner. What's your name?
My name's Arena Wade. It's nice to meet you today.
Hi, okay, nice to meet you as well. How do you like to be addressed?
You can just call me Rowena.
Okay, Rowena. And I use she, her pronouns. What are your pronouns?
She, her. Thanks for asking.
Of course. So before we start today's visit, there are a few things that I need to review just to consent you for the telemedicine service today. Can you start by telling me your date of birth?
It's December 3rd, 1986.
Okay. And I need to confirm that you're in the state of Maryland. Are you in Maryland today?
I am.
And are you at your home?
I'm at my home address.
Okay. Is anyone else going to be joining you on today's phone call?
No, I'm alone.
Okay. If you have any technical difficulties or if we encounter any during this visit, can we reach you at the phone number that we have on file?
Absolutely.
Okay. So today we'll be discussing your medical information. You're consenting to any person on your end of the service hearing this information, and understand you may exclude anyone on your end of the communication if you wish to do so. At times, the information and assessment gathered during telehealth service may be insufficient given the nature of being remote, or that equipment failures may occur, which may require us to switch to another form of communication or an in-person visit to complete our assessment. There could be security failures leading to a breach in privacy. Do you consent to the telemedicine appointment?
I do.
Okay, great. So tell me, what brings you in today?
Well, I realized I was pregnant a few weeks ago, and it's not a good time for this pregnancy to happen. So I would like to consider an abortion.
Understood. I can certainly help you with that today. Tell me, are you mostly interested in a medication abortion?
I am.
Okay. I always like to start by checking in with my patients. Do you feel confident in your decision to have an abortion?
Yeah, I'm 100% sure.
Okay, that's great to hear. I can certainly support you through this process. Before we talk more about the medication abortion, I want to ask you some questions about this pregnancy and about your health history. Can you start by telling me when the first day of your last period was?
Um, I have an app, and it was about 7 weeks ago, and it was a sure period.
Okay, so it sounds like you're pretty confident of the dates of your last period.
Yes,
Okay. Are your periods usually regular, meaning do you get about one period a month?
I do. It's pretty much like clockwork every 4 weeks.
Okay. And was your last period a normal period for you?
Yeah.
Were you using any form of birth control within a few months of your last period?
No, honestly, we just use condoms.
Okay. And have you taken a pregnancy test yet?
I have. It was positive 2 weeks ago.
Okay. Have you had any ultrasounds yet in this pregnancy? It's okay if you haven't.
I have not.
Okay. And are you having any pregnancy symptoms? Things like nausea, vomiting, breast tenderness?
Yeah, pretty nauseous right now. Don't feel very good.
Okay. Have you had any vomiting?
No vomiting, just nausea.
Okay. I'm sorry to hear that. I know that nausea can be an unpleasant symptom of pregnancy. We can talk more about things that can make that a little bit better. Have you had any bleeding or pain since your last period?
No.
Okay. So next I'm going to ask you some questions about your health history to make sure it seems like medication abortion is a safe option for you. Are you taking any medications?
No.
And I'll specifically ask about a few medications. Do you take any corticosteroid medications?
No.
Okay. And no blood thinners or anticoagulants?
No.
Okay. Do you have any allergies?
Nope, nothing to what I know of.
Okay. And do you have any medical issues?
I have asthma, but it's mainly when I was a kid. I haven't used my inhaler in a long, long time.
Okay. Do you still have an albuterol inhaler?
Yeah.
Okay. Any other medications that you have for your asthma?
No.
Okay. And it sounds like you haven't needed to use your albuterol inhaler in a while. Is that right?
Yeah, probably for 5 years or more.
Understood. Have you ever needed to be hospitalized for your asthma?
No.
Okay. All right. Any other medical issues that you can think of that you've had in the past or currently?
Nope.
Okay. And I like to specifically check in just by naming a few medical issues. Have you ever had any bleeding disorders?
No.
Have you ever been told that you're anemic?
No.
Any history of adrenal failure?
Mm-mm. No.
Okay. And have you ever been told that you have porphyria?
No.
Okay. It sounds like there's no information in your medical history that would make medication abortion not a good choice for you. Next, I'll just ask some questions about your pregnancy history. Have you ever been pregnant before?
Yes, once before.
Okay. And what was the outcome of that pregnancy?
I delivered my daughter, and that was a very smooth delivery.
Okay. I'm glad to hear that. Was that a vaginal delivery or a C-section?
A vaginal delivery.
Okay. Did you have any complications during pregnancy?
No.
No. Okay. And have you ever had any surgeries before or procedures?
No.
Okay. All right. Well, thank you for reviewing all of that with me. It sounds like you meet our criteria to move forward with a medication abortion without us requiring an ultrasound or blood work to be reassured that this is a safe option. Would you prefer to move forward with the medication abortion without the need for this testing?
Yeah, I would love to avoid any testing I can.
Absolutely. We can do that. So when you're early in pregnancy, there are two options for how to have an abortion: a medication abortion or a procedure abortion. Both of these are safe and effective, and the best choice is really the one that sounds right for you. Do you want to hear about both of these options or only the medication abortion?
I really don't want to have a procedure, so I'm happy to just focus on the medication abortion today.
Understood. We can absolutely do that. So now let me tell you all about the process of medication abortion so you know exactly what to do and what to expect. For the medication abortion, the process will start with you taking a pill called mifepristone. This is a pill that you swallow. You should take the mifepristone before 11 weeks in pregnancy. If you're 7 weeks in pregnancy now, that gives you time to be able to get these medications and take them before you hit that 11-week point. Most patients don't have any bleeding after taking the mifepristone alone. You probably won't notice many symptoms at all. You'll wait about 24 to 48 hours after taking the mifepristone, and then you'll take the next set of pills called misoprostol. There will be 4 misoprostol tablets, and you'll take them by letting them dissolve either in your cheeks or in your vagina. Both of these are effective options, but one benefit to taking these pills by putting them in your vagina instead of in your cheeks is that it can cause less nausea and vomiting by placing them in your vagina. I know you're already having some nausea, so that might be a nice thing to avoid.
I think I'd prefer that route.
Okay, we can certainly make a plan for that. Let me tell you more about how to take those. So what you'll do is you'll open up the misoprostol packets and you can stack them in kind of like a little tower, like a Smartie tower, and place them inside the vagina all at once. You could also place them in one at a time if that's easier for you, but they should be placed all in one sitting. You want to place the misoprostol tablets as deeply into your vagina as you easily can, but it shouldn't be painful or uncomfortable. I usually suggest just placing them like a full finger's length into the vagina. After you place those misoprostol tablets, I recommend that you sit or lay down for about 30 minutes to an hour just to give them time to dissolve. If you notice those misoprostol tablets fall out within that hour, you should replace them in the vagina. Do you have any questions about how to place those tablets?
No, it's all very clear.
Okay. So you can expect the vaginal bleeding to start pretty quickly after taking those misoprostol tablets, usually within a few hours. I expect the bleeding to be heavier than a normal period, crampier than a normal period, and you'll pass clots and pregnancy tissue, so you want to make sure that you're prepared to see that. I typically recommend that patients are home when they're going through this process, somewhere where you're near a bathroom, and really just have some time to dedicate to taking care of yourself. While I expect the vaginal bleeding to be the heaviest on the first few days of this process, you probably will have some bleeding for up to 2 to even 4 weeks. The bleeding is going to be getting lighter over time, and it's really those first couple days that are the heaviest. Questions so far?
I think I can handle this. I think I have the information.
Okay. Will anyone be with you while you're going through the medication abortion process?
Yeah, my partner will be home. My daughter will be home. So I will have to juggle that a little bit, but I have a lot of support.
Okay. All right. I'm glad that you have support people with you and someone who can help you get through this process. So next I want to go through some risks of the medication abortion. While medication abortion, again, is really safe and effective, there are some risks. And these are the reasons that I would want you to call us and present to an emergency department near you. The first is if you have really heavy bleeding. And remember that we do expect you to have heavy bleeding and gushes of blood with this process. But if you have severe bleeding where you're saturating, meaning like totally soaking front, back, side to side, 2 pads within an hour for 2 hours in a row, this would mean that you went through 4 saturated pads within a 2-hour window. This would be too much bleeding. And you would want to give us a call and present to an emergency department to be evaluated. You could potentially require the procedure to control or stop the bleeding. The other, do you have any questions about that?
Just to clarify, so it sounds like if I have a big gush, but it doesn't continue beyond an hour, it's probably going to be okay and something I can monitor.
Exactly. If that were to happen, you could put a new pad on to continue monitoring that bleeding. Any other questions about that?
All clear.
Okay. Another reason we would want to hear from you is if you don't have any bleeding within a day of taking the misoprostol tablets. This could be a sign of an abnormal or ectopic pregnancy, which is a pregnancy outside of your uterus. And ectopic pregnancies can be life-threatening. While you don't have any risk factors or symptoms of ectopic pregnancy, it would be concerning if you had no bleeding with this process, and I would want you to give us a call. If you were having concerning symptoms like severe pain or feeling unwell, like you might pass out, again, this would be a reason to go to the emergency department.
I understand.
Okay. Another thing to look out for is really intense pain, like I mentioned with this medication abortion process. While I do expect you to be crampy, and I expect things like ibuprofen and rest and a heating pad to help that crampiness. I'm going to send a prescription to your pharmacy for extra strength ibuprofen, and you can take one of those every 6 hours as you feel like you need it. However, if your pain is really severe and it's not improved by that ibuprofen, heat, and rest, this could be concerning and would again be a reason to call and present to the emergency department. The last thing to look out for are signs of infection, like a fever. If you were to have a fever over 100 degrees that lasts for more than 4 hours, again, call and come into the emergency department. While medication abortion is very effective, there's a small chance that the medication abortion doesn't work completely, causing either a small amount of pregnancy tissue to be left in the uterus or for there to be a growing pregnancy if the medication abortion fails. If you were to have a continuing pregnancy after a failed medication abortion, the pregnancy could be affected by birth defects. For that reason, it's really important for us to have some kind of follow-up plan. There are a few different ways that we could coordinate a follow-up, but one is just to do another telemedicine appointment just like this 1 to 2 weeks after the medication abortion. This would give us a chance to check in and make sure that things are all sounding reassuring that you've had a complete normal medication abortion process. Would you prefer to have a telemedicine appointment like this for your follow-up?
And what's the other option?
Yeah, so another option would be to come into the office for an ultrasound. This would allow us to look at your uterus and confirm that we no longer see a pregnancy.
I think I'd love to just have another telemedicine visit.
Yeah.
That'd be a lot easier for my life.
Understood. I think that sounds like a good plan. We'll get that scheduled after today's appointment. I will tell you a little bit about what I would expect to hear when we do that telemedicine appointment to be reassured that the medication abortion happened completely. Some things that I'll listen for during that visit is to confirm that you had bleeding that was heavier than a normal period within a day of taking those misoprostol tablets, that your bleeding's gotten lighter over that 1 to 2 week window, that your pregnancy symptoms, like the nausea you're having, are getting better or gone, and that you feel like you passed the pregnancy tissue. So long as everything sounds normal during that telemedicine follow-up appointment, you'll plan to take a urine pregnancy test at 4 to 5 weeks after the medication abortion to confirm that it's negative. If the test is still positive, it would be important for you to call us so that we can get you scheduled for a follow-up appointment. Do you have any questions about this plan?
Is any pregnancy test fine, like the one I could get at CVS or Dollar Tree?
Absolutely. Any pregnancy test that you get at Dollar Tree or a pharmacy is just fine for this. Okay. So I can send these medications to your pharmacy here in Maryland. I'll also send that prescription for the extra strength ibuprofen for the cramping pain. Would you like me to also send a medication for your nausea?
I would really love that.
Yeah, absolutely. So I can send an anti-nausea medication called Zofran. You can take one every 8 hours as you feel like you need them. I usually recommend patients take this medication about an hour before taking the mifepristone, just to decrease the chances that you vomit after taking mifepristone. If you were to throw up within an hour of swallowing that mifepristone pill, give me a call so we can talk about sending you another dose. I know this was a lot of information that we reviewed today, so let's do one more check-in. Do you have any questions about what I've explained?
I feel like I can do this. Yeah, I don't have any questions.
Okay. I like to do something called teach back at the end of these appointments to kind of confirm your understanding and give another opportunity to address questions. Do you want to start by telling me how long you'll wait in between taking that first mifepristone pill and taking the misoprostol tablets?
So I'm planning, once I get to the pharmacy, to probably take that first pill as soon as I can. And then I'll probably wait 8 to 12 hours after that to put the pills in my vagina. Does that sound okay?
That can work. A standard time frame to wait is 24 to 48 hours, but we know that taking those pills within a time frame of 6 to 48 hours is also highly effective. So if you wanted to wait, did you say about 8 to 12 hours?
Mm-hmm.
Yep, that's an okay window. Okay. After waiting the 8 to 12 hours, you would place those pills in your vagina.
Sounds great.
Can you tell me some of the things that you're going to expect to happen after placing those tablets?
Yeah, what I heard you say was I'm probably going to start cramping. I'm probably going to take some ibuprofen or heat or rest for that. I'm probably going to start bleeding, and I can bleed pretty heavily, but it shouldn't be more than, I think, 4 pads over 2 hours completely soaked. And if that's the case, I'll call the emergency number or 911.
It sounds like you have a great understanding of this process. I'm going to send written instructions through your MyChart in your after visit summary. And included in those instructions will be 24/7 phone numbers that you could call us with any questions or concerns. I'm also going to send some documents through your portal. And these documents include the medication guide, which is an FDA-required document whenever we provide mifepristone to patients. It has an overview of the whole process that we've discussed today. Before I send these medications and the written information, we'll need to sign some electronic consents. I'm going to send these over now. The first one is called the Patient Agreement Form. It's another FDA-required form that we review whenever we give mifepristone. It basically says that I gave you that medication guide and that you understand the steps, the risks, reasons to seek care, and how to follow up after your medication abortion. I'm also going to send the clinic consent form for medication abortion. It reviews the other options that we discussed, risks and benefits of the medication abortion. Take some time to review these now and e-sign whenever you're ready. Just let me know if you think of any questions.
Okay, so I'm going to look out for 2 things to sign. Great. I see them and I'm signing. I feel like I've been really adequately counseled.
Okay, wonderful. I can see that you've e-signed. Now I'm going to send these medications, which include the mifepristone, the misoprostol, the ibuprofen, and the Zofran to your preferred pharmacy. Know that sometimes pharmacies need to order these medications, so it might take 1 or 2 days for them to get them in stock. If you're having any trouble picking up the medications within the next week, please give us a call so we can help.
Okay, I'll check in with my pharmacy today.
Okay, wonderful. The other thing that we can discuss today, if you're interested, is birth control. Have you thought at all about whether you want to prevent pregnancy within the next year?
I do. I would like to
Okay.
prevent pregnancy.
Okay. Is birth control something that you want to discuss today? It's totally up to you.
I I feel like I know all my options. I really would like to stick with condoms. Yeah.
Understood. That sounds like a good plan. We're here if you ever want to discuss other options in more detail. Another thing that I can offer is something called an emergency contraception pill. Is this something you want to hear more about?
Oh, yeah. Is that similar to Plan B?
Exactly. Plan B is one form of oral emergency contraception. Let me ask you a couple of questions so I can get an idea of what emergency contraception pill might be effective for you. Can you tell me your height?
I'm 5'3",
Okay. And what's your weight?
130 pounds.
Okay. So I think that the Plan B would be an effective form of emergency contraception for you, and it sounds like you're familiar with that name. I can
Yeah, I've
send
definitely used it before.
Oh, good. Wonderful. So you might remember that the way that you use it is by taking it as soon as possible within 5 days of unprotected sex to reduce your chances of becoming pregnant from that single time having sex. I can send this by prescription to your pharmacy, but know that it's also available over the counter. Sometimes when I send this medication to your pharmacy, your insurance coverage might be a little bit better, but they might also tell you that you need to access it over the counter.
Sounds great. I would love to have that as backup.
Okay, I'll send it with some refills for you as well, and you can just call the clinic if you need more.
Thank you.
Any questions about the Plan B or medication abortion process before we complete today's appointment?
No.
Okay, and is there anything else that I can do to support you today?
This has been such a great visit. Thank you so much.
Of course, it was wonderful to meet you. Feel free to reach out to the clinic with any questions or concerns. We'll end the visit now, and our registration assistant will give you a call to schedule that follow-up appointment.
All right. Thank you, Gracie.
Of course. Take care, Rowena.
Bye.